Ooh, Hi everybody. I can't remember the last time I made an update. I just got a message from someone saying that they wanted an update, so I'm making one. So as far as I know now, I'm pretty much not even a patient at MD Anderson. They told me on the 3rd that they can no longer treat me with chemo because chemo wasn't working, so on and so forth. I have an appointment with integrated medicine, which is dealing with holistic, using Chinese Chinese medicine or whatever, like acupuncture and stuff, yoga, Pilates, little things like that that they'll still offer me. I went to New York. I went there on the 10th and I came back on the 13th. It was kind of not too sure what to feel about that visit, but I came home with about 3 other options, so I came home with something. I went to a place called Sloan Kettering, Memorial Sloan Kettering. They are off of York Avenue in New York. I think it's 62nd and York Avenue, I'm not sure. I originally went there to go see Dr. Suzanne Wolden. She is head of the Department of Radiation and with oncology. She normally treats synovial sarcoma or any type of sarcoma with radiation. So originally I went there to see her for a clinical trial, which I did not actually qualify for that because your lung nodules or your lung tumors are supposed to be under 2 centimeters in order to do full lung radiation, and mine are way beyond 2 centimeters. So from there, they suggested that I see pediatric oncology because they were actually able to get me in the same day that I saw that person, Dr. Wolden, Suzanne Wolden, and they got me in like the same day. I just had to go see them later on in the day. So the person that I met in pediatric oncology was a woman named Emily Slotkin, Slotkin. She deals with sarcoma patients that are in pediatrics, and she is the one that actually gave me more options than what Dr. Wolden had given me. Dr. Slotkin left me with a clinical trial option, which was actually deemed that I couldn't do it because they had actually closed the trial. There wasn't enough positive feedback, and I'm not sure which one it is. I'm also trying to do one for immunotherapy, which is where they extract your T cells from your body and they extract cells from your tumor, and they switch out your T cells or they infuse your T cells with something, and then they infuse it back into your body, which enables your body's own immune system to fight cancer, which I'm still hoping that I can do that. From there, I have one more option, and that is 2 different types of chemo drugs that I have not been offered at MD Anderson. But they will have to be given together, and my platelets will have to be up. And they also said that there is another clinical trial that has absolutely no qualifications or criteria that you have to fit in order to do, which I don't know if that's still an option for me or not. But right now, as I am making this video, you can see I'm in the hospital. I'm in observatory at MD Anderson. I had 2 days ago, I started having some really sharp pains in my chest, like around here, and it radiates to behind my shoulder, on my right shoulder blade, but it's internal. It's not on the outside of my shoulder blade that hurts. It's in between my ribs and my right shoulder blade. So they're saying that the tumors have progressed, and it may be the tumor that is the way it's growing. It's weird shaped, and it may be obstructing somehow, and causing me pain. So, and I had headaches really bad. So they wanted to rule out brain tumors or anything. So I did a CT earlier. I'm sorry. Sorry. I did a CT earlier for my head just to see if there was any kind of masses or anything, and so far they said there's none. They said that on the scan that I showed some type of sinusitis or something like that. So they're gonna kind of give me antibiotics to try to clear that up. I have to do 3 units of blood because my hemoglobin went from 8 while I was in New York to 6.5, and I haven't even been home a week yet from New York. All in all, I'm feeling pretty good. I'm a little emotionally going through some things. I'm coming off of the birth control that I've been on for the past almost 3 years, Lupron. So I haven't had a period in like almost 3 years. Emotions are getting pretty tense and pretty high. So we're just more or less, or should I say, I'm just more or less playing the guessing game and seeing who can come up with what. And hopefully something works out. If not, hey, c'est la vie. I've done the best that I could do. I fought as much as I could, but I'm still pushing, and I will still push even if Sloan Kettering says that they can't do anything for me. If MD Anderson turns me away again and says that they can't do anything, I will find somewhere else to go, and I will give you all as many updates as I possibly can. If you have any questions, feel free to ask. I'm an open book. I will answer pretty much whatever questions you have. If you want any information on these doctors that I went to go see, or where I found my information to find these clinical trials, feel free to message me, comment. If you care to email, I will give you my email. Whatever is easiest for you. I have a Facebook, I have a Snapchat, I have an Instagram. Just whatever. Let me know how I can help you or educate you in any way, or ask any kind of questions, and maybe I can ask questions while I'm here if you have any. Just give me a shout out. If you're still fighting, or if you're new to the synovial sarcoma gang, just keep fighting. Keep your head strong. Get a really good support system. That doesn't have to mean just your immediate family. I have support systems all over the country, all over the United States, all over Earth, more or less. Just let me know what I can do for you, and hopefully these videos will help you learn something. If they don't, maybe I can give you a couple of chuckles every once in a while. If that doesn't happen, well then, sorry.